Hi, I'm Leonard Adler, the host of the Green Jobs Pod. For this episode, really excited to have not one, but two guests for the first time on the episode. And we're going to be focusing on an area that's pretty important, pretty prevalent, and something we all have some experience with, and that's the healthcare system. And so I'm excited to introduce again our two guests today. That's Dr. Amy Collins and Shanda Demorest. So really excited both of you are able to make it and join us out here on the podcast. So just to start things out, if each of you could just share a little bit of your story, kind of how you got to where you are today and a little bit of the work that you do.
I first want to say that my story is very long because my journey has been almost an 18-year journey now. But it started actually back in 2007 when I had a huge aha moment. I was in the school pickup line waiting to pick up my fourth grade son. I was idling and listening to music and texting. And my little fourth grader came out of the school, opened the car door, and reprimanded me for idling. He told me that his teacher had read him a story about climate change and the impact it was having on polar bears. And he was concerned and he wanted me to take action and promise never to idle. And I made that promise because that's what moms do. But the truth is I didn't know anything about climate change. So that night, as a family, we watched the documentary An Inconvenient Truth. And I was then very committed to do what I could do. And we started to do whatever we could do at home, from energy efficiency projects to drying our clothes outside on a line and more. And then it became very uncomfortable living one way at home and this entirely different way at work. I should start by saying that I was a practicing emergency physician at that time. And I really started to wonder why I was leaving my environmental conscience at the door every time I walked into a shift. And I started bringing recyclables home, and it just became very uncomfortable. And I asked someone if I could start a recycling program, and I was told that recycling was illegal. And that didn't sound quite right to me. So I Googled hospitals and recycling, and I came across healthcare without harm. I was sitting actually right where I'm sitting now. And I knew at that moment I had sort of found my mid-career transition path. So I learned from Healthcare Without Harm that not only was recycling not illegal, but that the healthcare sector had a very large environmental impact. And healthcare operations were not only contributing to pollution, but to public health harms. And I got as educated as I could. Remained totally committed to finding a way to embed this into my career, and ended up writing a letter to my administrative team asking for permission to start a recycling program and a sustainability program. And I was given instant permission because I had a very, very visionary CEO. So in brief, I led the efforts at my two hospital health system for about 7 years as a volunteer. Led the work for a national healthcare system, which was a 26 hospital healthcare system, for a couple of years. And then I had a series of job offers that got pulled or fell apart at the last minute, a number of disappointments. So I then transitioned to my work to trying to build a network of physicians who are interested in this work. And we started with 1 or 2, and soon we were 10 and 15, and repeatedly made the case to the organization that in addition to supporting nurses, which they were doing, that it would be great to support a physician movement, which ultimately led to me having a couple of consulting jobs with Healthcare Without Harm, including a more long-term one, while still practicing clinically, trying to build a physician movement. And it was back about 2 years ago when I made the decision, with Shanda's help, to leave clinical medicine and focus on this work. So I now work for Healthcare Without Harm and our sister organization, Practice Greenhealth, as our medical director. And I lead the health professional engagement work and our Climate Smart Collective, which is a national network of health professionals interested in advancing environmentally responsible healthcare. So that's about 18 years in a couple of minutes.
Yes, and I'm sure we're going to talk more about it, but that's an amazing journey. And actually just one part of that story that I think is can resonate, I think, with people regardless of the sector they're in, is the work you did kind of within an organization to make an impact. Because the notion of what is a green job, what's a climate job, some people may do something full time, but I think a lot of people are really want to know, hey, well, what can I do today from where I am to make an impact? So I think that piece of your story, we may circle back to that before we're done today, but that's great. So
Yeah.
great. We'll turn over to you, Shanda.
Terrific. Thanks, Leonard. Super, super happy to be here. Specifically happy to be here with Amy, who is my work spouse at Healthcare Without Harm and Practice Greenhealth. One of these days, I want you to tell my story and me to tell your story. And we've both shared it so many times. It's awesome.
Yeah.
So I have a lot of similarities to Amy, but I also have a lot of differences for how I moved from being a bedside nurse to working with Healthcare Without Harm and Practice Greenhealth. I grew up in a pretty rural community in Minnesota, and my family really just leaned into nature and the outdoors. So we were foraging and gardening and planting and hunting and had a really close connection ever since I was little. And so I had that lens. I could have been, like Amy's son saying, how come we're not taking better care of this planet? Which I did when I accidentally landed in nursing school. Not so much an accident. We have this connection between healthy people and a healthy planet. But when I was in my nursing programming, I really struggled to see the connection between the wellness we were trying to build in the health sector and what we were doing, to our environment simultaneously, similarly to what Amy shared. It didn't feel right to me. And especially when I was practicing as a cardiovascular nurse, the resource intensity, the waste, the energy utilization, it just did not feel to me like we were as connected with the health of humans as we should be. So some elements that I really tried to pursue early was some legitimacy around building, honestly, like a little bit of an environmental portfolio for myself. I tried to build some skills through a formal graduate program. So I went through a Doctor of Nursing practice in health, innovation, and leadership. And basically all of my courses there around finance or systems change or change management, I was able to apply this environmental sustainability in healthcare lens. I pursued some different certifications through the U.S. Green Building Council and basically just tried to boost my resume a little bit so that, as a nurse, I had some of these formal qualifications and certifications that also legitimized me as somebody who knew something about, formal sustainability. And I also, like Amy, started Googling what is happening out there. I think this goes to show that, we don't learn formally about sustainability in healthcare in our curricula. Certainly we didn't in the past. It's starting to come a little bit more front and center. We can talk more about that. But when health professionals are left to their own devices, like many other fields, we go to the internet and try to find others like us. And so for me as well, that was Healthcare Without Harm. And I set very firm sights on wanting to come to this organization and to bring my nursing lens. I knew there was so much work happening with physicians that Amy was leading, and I wanted to contribute even more from that sort of multidisciplinary, bringing in the nurse voice. And I've been here for about 6 years now, and my role is to lead our practice Greenhealth network. So we have about 1,700 hospitals across the U.S., a little bit up into Canada, and we're working to support them on all things sustainability and climate mitigation, and I know we'll go down that path a little further.
So again, an amazing journey. And again, I think there's things from your story that, then again, to me, resonate regardless of the field that someone's in. And part of, at least what I heard in your story, was the things you were doing to kind of invest in yourself, whether it's through the learning you did, the training, specifically on these issues. And, nowadays in the career space, when things there's so much change happening and there's a lot more uncertainty, I think at least one suggestion I try to encourage people is to think about what can you control, and investing in yourself is something you can control. And so it's great to hear where you invested in yourself, and then also the return on that investment in terms of how it's played out in terms of as you continue your career. So again, I think that's a great story. So a couple things. So I think, we're going to dive in obviously in terms of the organization, Healthcare Without Harm, that you both work for and the work it does. But I think for people that are listening who don't work in healthcare, curious maybe if you can share a few things like to kind of tell everyone why is it important that we care about, the issues of the environment and climate in the healthcare system.
I think it might be a good idea to start and talk about how Healthcare Without Harm was founded and why. Healthcare Without Harm is a global organization. We work worldwide to transform the healthcare sector so that it reduces its environmental impact and becomes a community anchor for sustainability. And Healthcare Without Harm formed back in the 1990s, really deeply grounded and rooted in environmental justice and the belief that you can't have healthy patients on a sick planet, and the understanding that the healthcare sector was polluting, and healthcare operations not only contributed to environmental pollution, but also to adverse public health impacts. One of our first campaigns was to close down medical waste incinerators. In those days, medical waste was incinerated on site, and the burning of medical waste, created toxins such as dioxin emissions and pollution, and mercury emissions, both of which have adverse health effects. So that was our first campaign, to close down these medical waste incinerators. Because it just felt against the principle of doing no harm, against the Hippocratic oath that healthcare operations were contributing, to pollution and adverse health impacts. And that was a successful campaign. And our following campaign was to eliminate mercury from the healthcare sector. I'm old enough to know, Shanda isn't, that we used to have lots and lots of mercury in healthcare. Our thermometers that were used to take my temperature when I was a kid, that we used when I first started in healthcare, contained mercury. There was mercury in lab reagents and blood pressure cuffs and just all over. And mercury is a very, very potent neurotoxin. So again, another example of where, in the process of providing day-to-day healthcare, we were ultimately contributing to pollution and patient harm. So we launched a campaign to eliminate mercury from the U.S. healthcare sector, and that campaign started with the return of one mercury-containing thermometer here in Boston at Beth Israel Hospital, and led to a successful campaign to eliminate mercury from the U.S. healthcare sector, and ultimately culminated in a global treaty being signed back in 2017 to eliminate mercury from the healthcare sector. So, really speaks to our belief that the healthcare sector should do no harm within through its operations.
Couple thoughts I'll sprinkle in here too, really, that gets to the why climate change and why healthcare. People are sick. People are getting sicker and sicker from climate impacts all the time. So, we see it in the news, we see it in our communities, whether it's wildfire or extreme heat or flooding and other extreme weather from disasters, even things like mental health impacts that are related to some of these extreme climate experiences. Healthcare's on the front lines of that. Healthcare has always been on the front lines of working with patients and communities when they're facing these climate disasters, but only recently has it really been, I would say, more in the public eye, but also more in the eye of the leaders of healthcare. And in addition, health professionals are super trusted. Like year after year, polling shows that nurses, physicians, pharmacists, the list goes on. We are the most publicly trusted folks out there, and so it's really important that when we think about whatever our interface is with the healthcare ecosystem, whether you are a traditional health professional or you're a patient or a family member of a patient, there is that connection for us all. And when we look to some of our leaders in the healthcare sector saying it's really important that we take action on climate change. The reason that we need to stand up and do that is, like Amy has said, to stand by our oath to do no harm.
Shanda mentioned that the health sector is on the front lines of the climate crisis. The healthcare sector needs to be prepared to care for patients. Climate change is making patients sick. There's also this intersection between extreme weather and our ability to deliver care. These extreme weather events are increasing in severity and frequency. You know, everyone knows that. It's in the news. We had these horrible wildfires. We've had floods and hurricanes. And not only do these events cause patient harm and death and injury and mental health impacts, they can impact healthcare delivery and access and our supply chains. Last year with those hurricanes and the flooding, we had a significant shortage of IV normal saline bags and dialysis bags in the United States. And the reason being that the manufacturing plant had to close due to damage. This was a manufacturing plant in North Carolina. So many examples of where these extreme weather events not only impact health, but they impact hospitals, health systems, infrastructure, and our ability to provide care, you know, during and after these events. And what I think many people don't realize is the healthcare sector contributes to the climate crisis. Healthcare delivery is very energy, resource, and waste intensive. And the sector has a really big climate impact. In the United States, the healthcare sector is responsible for about 8.5 to 10% of U.S. greenhouse gas emissions, which doesn't sound like a lot. But if the U.S. healthcare sector were ranked as a country, we'd rank 13th in the world for emissions. So we have this big climate impact. So there's so many reasons, there's so many intersections between climate, health, and healthcare, and so many reasons why it's important for the healthcare sector to show climate leadership, you know, to reduce emissions, to prepare their facilities for climate impacts, and sort of to leverage that health sector influence to advocate for climate solutions at multiple levels.
Yeah, no, I think you've spoke passionately about the why, as to why is this important, you know, given its footprint from like what you're describing. And as you were talking, I'm kind of going through, okay, kind of waste products, the energy intensive, and also I'd imagine, you know, it varies, but a lot of, can think a little bit about healthcare institutions as large enterprises. And so, so the fact that there's a focus on, you know, how can this system, you know, be more environmentally friendly, reduce its impact on the climate. It's great that there's again, the organization I work for. So Healthcare Without Harm, is that the leading one in the country, or is there, just curious, because you said it's been around for a couple decades, which is great because people have been aware of this and trying to make an impact for a while now within the sector.
Mm-hmm. Yeah, that's a great question, Leonard. We are the leading organization in the U.S., also globally. So we have multiple regional offices across the planet. In fact, we reach nearly 80,000 hospitals with our different U.S. and global networks combined. And at the same time, the ecosystem is getting more and more robust, which we're really happy about because, you know, if Healthcare Without Harm was going to solve the climate crisis via healthcare, we would have done that already. We need a lot more work in this space. So we're seeing examples of organizations pop up that are working directly with health professionals around advocacy efforts, for example. The policy advocacy that this work requires is only more powerful with health professionals. We also see a lot of like consulting organizations. Health systems themselves are stepping up and building coalitions. So, sometimes we'll hear that the ecosystem is more crowded, but we think it's a really good thing because we're building these partnerships and these collaborations and strengthening the work overall.
Great. Yeah. And then I think there was something kind of else, just kind of thinking about the impact. You talked about this about mercury. I think it's always great for people to hear what like examples of here's what success looks like. Here's what a victory looks like. So it's actually great to hear because I remember with the thermometers with the mercury and I always remember being very careful because if you broke it, it was like a hazmat situation or something like that. So it's great to hear about that as a tangible impact of the work of your organization. I'm curious if there's other examples of that that you can just share. Just again, trying to share some good news where we can these days on the podcast.
I could take the first stab at that, and Amy, you and I could bounce back a little bit here. Maybe I'll start by speaking to the huge momentum we've seen in the past couple of years around climate mitigation, so reducing emissions and the resilience work as well. So in 2022, the Biden administration launched something called the Health Sector Climate Pledge, and it's in alignment with the Paris Agreement. Basically, it asks health systems to reduce their greenhouse gas emissions 50% by 2030, 100% by 2050 for operational emissions. There's some other detailed elements in there about building a climate resilience plan, etc. So we worked with the HHS, Health and Human Services Department, to recruit health systems into that climate pledge. Now here we are in 2025 where the office that put that pledge together is no longer in operation under the Trump administration. But in the past 3 years, there have been over 900 hospitals across the U.S. that have signed on to that. So these facilities are actively reducing their impact on climate and then building out plans and processes for not if, but when they face some sort of climate crisis on the ground, like Amy was referencing. So that momentum is really exciting. Amy, I don't know if you want to jump in with any more specific examples of some of the folks that we're working with.
And I think I would probably start broadly. Basically, every single healthcare activity, from the boardroom to the kitchen to the operating room to the emergency department, generates waste and emissions. Healthcare has this huge impact. Hospitals are open 24/7. They have a big workforce. They, as we talked about, are very energy intensive. They're very waste intensive. Hospitals generate thousands, tens of thousands of tons of waste a day. We have a big transportation footprint from fleet vehicles and patient commutes and employee commutes and business travel. The healthcare sector has a big supply chain. The healthcare sector is heavily connected to climate intensive industries such as the fossil fuel and petrochemical industries through investments. We have a big food footprint. We serve lots of meals to patients, employees, staff, and visitors. So there are opportunities at all of those points to take action, reduce emissions, and reduce waste, with many success stories, in each of those categories. So, we're just seeing, a lot of innovation and action trying to, reduce waste, reduce travel, and food footprints, just broadly trying to reduce their impact. And everyone's journey is a little bit different. But many success stories have been gathered along the way.
And you laying out those categories, Amy, brought a couple thoughts up that folks might be interested in hearing a little bit about. This one's kind of cool. You mentioned transportation. I thought of Northwell Health out of New York. They have electric ambulances. So basically there are not emissions coming out from their ambulance travel. I'm also thinking about some of the work coming out of Boston Medical Center. This one's really cool. This is sort of a multi-solving example. They were opening a mental health facility, and there was a sort of a local nursing home that had been defunct. It hadn't been used for many, many years. And Boston Medical Center bought that nursing home facility and actually retrofitted the existing building to be net zero. So they were not only, not contributing to emissions, but they were serving a particularly vulnerable portion of the population. And those are just two examples of emissions reduction, but we could go on for years and years. And I definitely recommend taking a look at some of the case studies on our website of what that looks like. Another piece I want to throw out too is, as we've talked about this momentum and reference how so many health systems are jumping online for this, Healthcare Without Harm stepped into the void that was left when the Office for Climate Change and Health Equity under HHS pulled down that pledge. And so we picked up we picked up the reins and actually just this past month in May launched what we call the Health Sector CARES Pledge. CARES stands for Climate Action, Resilience, and Equity Solutions. And basically hospitals that are joining into this commitment can learn about all of those categories that Amy just referenced, where we can reduce emissions and build climate resilience. So they can see what it looks like to do that in their system and sign on to the collective together.
It sounds like we could have a whole episode just about all the different success stories. I will say, in terms of learning something new, I did not know about electric ambulances. So that is definitely something that I can imagine will become commonplace in the future. So since this is the Green Jobs Pod, do you want to make sure kind of we're talking about careers for a little bit? And, obviously it sounds like, both of you have jobs where, you have kind of your day jobs really get to make an impact on all the issues that we're talking about. I'm curious if you could give the listeners like a lay of the land just regarding what career opportunities look like for people in healthcare or connected with healthcare who want to make an impact on all the things that we've been talking about so far.
So I like to think about this work in two different approaches. And this applies to any industry, not just healthcare. Either we can be bringing our environmental passion and our environmental knowledge to a specific discipline. So in the case of Amy and I, we brought this environmental work to healthcare. Or we can bring a specific discipline to the enviro-sustainability sphere. So those are sort of like two distinct paths. As far as bringing health to sustainability and the environmental realm, that's where so many health professionals who are super passionate about this work can be bringing that patient care lens, that patient advocacy voice to, basically environmental sustainability programming that's happening in their workplaces and their communities, but that's a little bit more vague. I think one thing that we're seeing a really strong trend around is sustainability professionals actually in the healthcare ecosystem. So we might have traditional sustainability directors or managers who are trained from either their academic path or have built these skills over time, and they're applying it in a hospital or a health system setting. Decarbonization in a building looks very similar regardless of where you are. There are some nuances in healthcare that are, a little bit more patient specific, but ultimately an environmental engineer or a sustainability professional in this sector is going to be doing something very similar as they might in another sector. A couple other pieces that I like to think about are, how can we be applying our disciplinary knowledge to the environmental realm, even if we don't have a traditional job in that space, and I'm going to put an asterisk there, yet. You heard that Amy had a lot of volunteer experience. I did as well. That's part of skill building, I think, as this on-ramp into bringing environmental sustainability into whatever your discipline is. But I guess I would encourage folks really to think about how they can either volunteer with different organizations, or if they're at the beginning of their career, work on internships, work on different opportunities where they're not only contributing but they're building those skills at the same time. And Amy, I know you have some good health professional specific work here too.
Yeah, a lot of what I do is have conversations with health professionals who really want to integrate this work into their career. They don't want to leave their medical career. They really want to integrate this work within a medical or health-related career. And I think over the years since I started doing this work, we've seen a couple of trends that have led to this moment. When I first started doing this work, people talked about health professionals as champions or cheerleaders of other people's efforts. Now we're really talking about health professionals as leaders. It's great for them to be champions and support others', efforts, but health professionals want to lead. And as I said, increasingly, health professionals are reaching out to me like, how can I lead, an effort? How can I get a paid job? How can I integrate this into my career? And I think the other trend we have seen, and I think Shanda has probably seen it with the sustainability professionals she works with, I think there's been a trend from people doing this work as a volunteer, like a nice to have at a hospital, to paid positions and realizing that these positions are integral to the hospital's, strategy, and that they need to invest in this work in the same way they invest in other programs like, quality and safety, that they really need to invest in the work if they are going to get results. So I think those trends have led us to this moment where health professionals, they want to do this work. And one way we are seeing this be done is we know of a couple of health professionals who serve as the director of sustainability or chief sustainability officer for their hospital health system. But we've seen this new position emerge, the medical and clinical directors of sustainability positions. And these are positions specifically suited and tailored for health professionals to work in a compensated, recognized way in partnership with their sustainability team and directors, to really have an opportunity to focus on mobilizing and educating the clinical workforce, identifying the greatest opportunities for health professionals to take action, and to lead efforts to reduce the climate environmental impact of clinical care. Because we know that the clinical care that we provide is the single largest factor driving healthcare waste and emissions. And, increasingly, we are seeing health professionals wanting to step into these positions and sustainability professionals recognizing the real value of having a health professional be an integral part of a sustainability team. So it's a really exciting moment and really speaks to the momentum from us as health professionals being, champions and cheerleaders to being, real leaders. And I'm really hopeful that this trend is going to continue.
Hear, hear. Well, and despite what we've said, Leonard, healthcare is still like 15 years behind other industries for sustainability professionals. I mean, I'm curious what you're seeing. You have this very high level view of jobs across all industries. Are some of these trends also present in other disciplines? Some of this lagginess, this volunteer to more formal shift. What are you seeing?
Well, I think there's a lot of variability, but I wanna just hold the point about people's career opportunities within healthcare just for a moment, because what I want to be able to highlight for the listeners is, at least from what I've heard, there's kind of there's two categories, at least I've been hearing so far. One is people specifically kind of from the clinical side, right? So you may be a physician and you really care about climate, the environment, and you already have a busy day job of just doing what you do, but you really care about these issues. And are there ways that you can integrate it without having get more additional, potentially even uncompensated things on your plate to do? And it sounds like there are more ways that this is being integrated, so people can do that. And you also gave examples of some specific roles where people who have a clinical background can also make a kind of a full-time contribution on these issues within healthcare. It seemed like that's one category. And I think the other one, and I'm also trying to be mindful of people who are, many people who aren't working in healthcare but care about health and are maybe thinking for the first time, maybe like I am, like, oh, maybe this is an area that there could be a job in this system for me, even though I'm not a doctor, or a nurse or another medical professional. And I think that's, to me, an interesting thing, if that's the case, to be able to highlight for people. So, for example, you can imagine, someone who's, getting a sustainability, degree right now, or is even thinking about pivoting. They had a sustainability role someplace and moving somewhere else. Because I think earlier, I think it was you had mentioned that, let's say if you're trying to think about issues of energy efficient buildings, well, if you know how to do that in one type of building, you can apply that into a hospital, right? Or another healthcare area. So I think the thing that I want to be able to, call out is this other category where healthcare as a area for people who are job seekers who have potentially skills or are interested in working there, it sounds like there are certainly more opportunities now than there were when Healthcare Without Harm started, a couple decades ago. So I just want to kind of reflect back to see if that summary is kind of on point, or if there's other dimensions to kind of what the kind of work that can be done looks like within the systems.
Those categorizations were right on. And actually, very recently, Amy and I just came out of our National Clean Med Conference, which is a really good example of what this community looks like in practice. Each year, we host a professional conference for all the folks in the ecosystem, whether they're traditional sustainability or, like you're saying, clinical, that's bringing in that environmental passion. And so we have hundreds and hundreds, but that doesn't represent us all, of people that are coming together to learn and network and share. But for folks that are curious about, what those roles look like, I definitely encourage, a little bit of cruising through the jobs boards and the opportunities of health systems. That's where those opportunities are going to be showing up. And there are more and more all the time, especially because, to our points, climate is becoming an increasing priority for health systems to address. But I think also we're seeing leadership recognize that Gen Zs and millennials in particular are really passionate about, working on environmental sustainability in their roles. They're seeing it as a recruitment and retention opportunity. There's this mission orientation element. And so this trend that we're lifting up is only going to continue to grow. We'll see more and more sustainability opportunities within healthcare.
That's great. And I would also imagine there's, business cases, the financial issues within healthcare, obviously, I would imagine paramount. And so I would imagine that there's significant business cases that can be made around this, reducing waste, reducing energy, reducing water, things like that. And so it would seem like that gives maybe some extra momentum to this, and also people who have skills, who have done this work and who can make a case for, how it can benefit the systems. It can help the cause.
And sometimes that's the predominant reason for health systems to do this work, because margins are so thin in the first place.
Yeah. If someone, let's say, had an idea or wanted to intern or volunteer or suggest a project to their local health system, is that is that a viable pathway, or do you have any advice for someone, because they might, let's say they look at the jobs and maybe they don't see anything today. But they still want to, maybe they really are passionate about it after they've heard everything we're talking about. They really want to do something. I'm curious if you have any, kind of tips for people in terms of how to kind of either get your foot in the door or kind of to begin to engage more with this?
If I had a nickel for every sustainability professional in healthcare that started out as an intern, I would have at least several nickels. Maybe more, maybe more than that. But that's totally a viable path. I'm an example of that. Amy is an example of that. Cold, bold outreach to, facilities departments or operational departments in healthcare, where you are basically making the case for what type of value you can bring to their organization. You can start as an intern, you can start as a clinician. I also would say, I think of several sustainability professionals that are working now at a high system level, really large scope that started out, basically in the equivalent of the mail department, right? Like working from the ground up. But what's really cool about these roles is that you add so much experience and credibility by going through waste sorts and recycling program establishment and just that nitty gritty, down to earth, dirty work that we all know, that is only building our, our resume and our experience in the sustainability realm. But you have to work towards those higher levels so that you can really affect broad scale systems change. Amy, I don't know if you have any other nickels that you could pick up from some of the intern routes.
I feel like I kind of started like an intern, so I agree with what you say, that it's sometimes really important to start that way and do that on the ground work and go up the ladder. And that ground level work is so important to get that broad foundation to be able to do this work. When I did this work at my hospital health system, we did have volunteers, interns. We had a couple of interns, really speaking to what Shanda said. Young people really want to engage in this work, and they really want to get started early on in college. So we're happy to host a couple of different interns, which really added value to our work. I think there are probably more interns interested in doing this work than there are positions available. But I think, persistence helps. Shanda and I often share our stories about how we got started in this work. And my story is really about persistence. And Shanda's story is largely about intention. I think if you combine purpose and intention, then you have a better chance of getting your foot in the door. But, I would encourage people who are interested in this work to do what Shanda said, to check the job boards, to check the Healthcare Without Harm and Practice Greenhealth website. We recently posted for an intern. Those opportunities are out there. And I think they're going to hopefully increase in frequency over time.
Great. Well, we appreciate those tips and also the encouragement of people. So again, particularly in these times, being able to share that story where the trend is, is going to grow, and that's tremendous. So definitely. I know we've been talking for a while. The time has been going by so fast. So want to give each of you a chance to share, anything that we haven't covered so far, that you think is important or just want to share. Just want to make sure we've had a chance to really cover. I know it's to cover both healthcare and climate in the time that we have. It's a lot. So, but if there's any additional things you want to make sure we cover.
Thanks, Leonard, for the opportunity to do the last chime in here. We'll all be a patient at some point. We are all community members of each other. And so I do want to elevate that even if we're not a health professional, even if you're not a sustainability professional, we all have a touch point with the healthcare ecosystem. And so putting those needs and those preferences and what we really care about, which presumably your listeners are going to be caring about the environment forward as a healthcare consumer, can also be so powerful. Let's show the leaders what we really care about.
Dr. Collins?
That's really what I was going to say, that health is a common denominator. Health is important to everyone. Healthcare is important to everyone. It's like food. We are all patients, or we're all going to be patients at one point. And I think everyone is invested in, a sustainable, high functioning, high quality, low cost healthcare system. The other thing I want to say is that, the healthcare sector absolutely needs to join other sectors in taking action to meet the goals of the climate agreement. They need to reduce emissions and prepare for climate resilience, but the healthcare sector cannot do it alone. We can't reduce transportation emissions unless the transportation sector, takes action and provides us with more EV vehicles. And we can't reduce food emissions until we have a more sustainable, agricultural sector. We can't reduce supply chain emissions until the purchasers and suppliers take action. And I think even patients, have a role. We all have a role in working together to help the sector meet their climate goals, because we can't do it alone.
Yes, well, amen to that. So
Yeah.
definitely, and we're definitely, and that I think part of, again, the intention of having both of you here was to really to put healthcare into the conversation that we've been having here on the podcast. And obviously, it's much broader than this, but we've had representatives, for example, from the legal industry, here, from traditional business here as well. So having healthcare, which again is so important, as both of you mentioned, we all are impacted by it. We're all going to be patients. So again, I think it's definitely important to have that part of the conversation, but it's great to hear about all the work has been done, again, going back now decades, and is being done, and the momentum behind it. And also a lot of again, you've been speaking to coalitions and how many of these different organizations within healthcare are working together on this, because I also can imagine there's strength in numbers. I noticed that even things around, let's say, the purchasing power, when you're able to bring together, people across an industry, there's ways that can make an impact. You're talking about the supply chain and things like that. So I think there's so many benefits from coalition building. Again, the work that you've all done, I think just demonstrates that. So before we wrap up, because there's a couple different organizations, I know that you've both mentioned Healthcare Without Harm, Practice Greenhealth. Want to make sure that you both can mention them and also give people the web addresses that they can follow up, because I'm sure after listening to all this, people are excited. They want to start learning more and finding ways to get involved.
You can learn more about our organizations at noharm.org, and you can also check us out at practicegreenhealth.org.
Great. And we will include the links in the show notes, so people will be able to also see that online. But definitely great. Want to make sure that people have a chance, because again, motivated, they want to do something. And again, I think was also mentioned too, it's this connection between a healthy planet and healthy people. It's something I certainly think about, and I think a lot of people think about that as well. And so again, the healthcare system really speaks a lot to the healthy people part. So definitely, again, it's really appreciate both of you taking the time to be on the podcast today. So, and again, really appreciate all the work that both of you and your organization are doing.
Thank you.
Thank you for all the work you are doing as well.
And I do want to say one other thing that I thought of is that doing this work has been my wellness. It seriously is my wellness. And doing this work allowed me to practice as a physician in a busy emergency department for years without burnout. So I think, times like we're in now, that, it's a very challenging time. Healthcare is very challenging. I just want people to know that this work is fun. It is mission oriented, it is meaningful, and it truly has been my wellness for the past 18 years. And that's why I can't give it up and retire, because it really is. It's the greatest group of people. And for me, at least, it has been so valuable to have mission driven work, in addition to that day-to-day clinical work. So I encourage, others to consider engaging in this work, just because it has been quite a journey.
That's great. All right. Well, with that, we'll again say thank you to both of you for taking the time and being with us on the Green Jobs Pod today.
Thank you very much.